Hi, I'm Dr. Evan Zelinger from Abington Aesthetic and Laser Medical Center. We're going to talk to you today about laser tattoo removal. What is a tattoo? A tattoo is just ink that's put in your skin. The ink particles are very, very large. So your body's immune system can engulf and take away that ink. So what we're going to do with the laser is smash those particles. We're going to shoot a laser into the corresponding color, and it's going to cause a photoacoustic disruption. It's going to smash those ink particles into smaller particles that are small enough now for your immune system to engulf and then take away. So what colors can be treated? Generally black and red are the best colors for removal because of the wavelengths that we have on most of the tattoo machines. Green and blue are usually the most difficult, and somewhere in between you have yellows and purples and orange. Those can be good and bad, depends on the type of inks. There's a lot of different inks out there, and even the black inks, some of the easiest colors, you can have difficult black inks and you can have easy black inks, even with red as well. So, what are the risks involved with this? The risks are you could have lightening of the skin, you can have darkening of the skin, that's called hypo and hyperpigmentation. Lightening of the skin is really my main concern when I'm doing tattoo removal. Lightening of the skin is when you get a little white spot in your skin. Not as much of a big deal when you're talking about someone who's got really, really light skin, but when you're talking about someone who's got darker skin, African American skin, it can leave a pretty significant white spot there. So you have to take a little care when you're treating someone with darker skin, and maybe someone with darker skin may want to think twice about doing this process, especially when we're talking about difficult colors like greens or blues. You may not want to do this. It's a little bit more of a risk for you. But if you have lighter skin, there's still a risk. It's not much, but there's a risk involved. You also can have raised scars, very rare, but you can have raised scars with this depending on how much you scar, how large the tattoo is, how dark it is. How many sessions does one need? It really varies. It really depends on the colors of the tattoo, how deep the tattoo, was there a cover up there. Generally going to take about 3 to 9 treatments when we're talking about black inks. That's a big range, and I know that varies quite a bit from person to person, but and from tattoo to tattoo, but there are a lot of variables. There's depth of the tattoo, there's how much ink your tattoo artist deposited in the skin, what kind of needles do they use, what does the tattoo look like, is it filled in black or is it just black shading? There's a lot of variables, and you really can never tell by just looking at a tattoo how many tattoos it's going to take. You really can only do it one by one. You'll have a better idea as you go along, but anybody that ever gives you a number and says it's going to be gone in 5 or it's going to be gone in 3 or 7 or 10, they don't know. Nobody knows. So, take it one by one. How long you're going to put in between each session. The more time you put in between each session, the better you're going to do. Generally, at the bare minimum, people can put in about 2 months in between each session. But if you wait longer, 3, 4 months, that's even better. Is this painful? This is a very painful treatment. There are ways to make this a little bit nicer. There are ways to use different types of anesthesias, but it hurts. You can use cooling for one, air cooling, ice cooling. Cool the skin. It makes it a little bit easier. Also keeps the skin a little bit safer because we are burning the skin a little bit. There's anesthesia, general anesthesia. You can use local anesthesia. We can inject the tattoo with numbing medications like lidocaine to make the skin completely numb. Obviously the injections involve a needle, so the needle does hurt a little bit, but you will be completely numb after the injections are completed. The problem with that is sometimes when you're putting that medication into the skin, you're increasing the distance that the laser has to travel to get to the tattoo. Lasers, generally the wavelengths we're using for tattoo removal are attracted to water. So you're going to lose energy as you go down into the skin. If there's more water into the skin from the injections, you're going to have trouble getting enough energy into the tattoo. So if you can possibly try to avoid the injections, avoid them. You can use a topical medication. A popular one is EMLA, which is a mix of lidocaine and prilocaine topically. It gets absorbed in the skin. It takes a long time to work, though. You have to put it on at least an hour and a half before you come in, and it needs to be occluded with plastic wrap or covered up with plastic wrap or a Band-Aid or whatever you have. If it's just left on the skin, it'll dry out, flake off, it won't do anything. You're going to get a little bit of pain relief with the EMLA, but it's not going to completely remove the pain. If it's a very, very large tattoo, you can use medications before you come in for your treatment, like narcotics, anxiolytics like Valium, or narcotics like Percocet. Those are only for very, very large tattoos, and you'd obviously have to have a ride. You wouldn't be able to drive yourself in or drive yourself from the appointment. You really need to have someone with you. And that's only for special cases and large tattoos. You can do nothing. Most people do nothing. Tattoo removal is generally very, very quick. You're really talking about anywhere from 5 seconds to usually 2-3 minutes for most of these tattoo removals. So most people just deal with it, and it hurts. It feels like hot grease hitting your skin, hot electric grease hitting your skin over and over again for a couple seconds, and then you're done. When you're done, there isn't much pain. Right after we're done, it's going to look white. It's going to look bright white, the skin is going to be raised, and it's going to start to turn red after that. At that point, we're going to put on a topical antibiotic and ointment to keep it moist, and then we're going to cover it with a non-stick bandage. You're going to keep that bandage on for at least 24 hours, give or take a couple hours, and then you're going to wash it. You're going to wash it once a day after that. Not before then, not when the bandage is on, but once a day after that. You need to always, after you wash, put on ointment. It doesn't have to be antibiotic ointment after the first day unless it looks like it's irritated or infected, like red, raised, or with pus, but you have to put some sort of ointment on so it doesn't dry out. If it dries out, then your risk of scarring goes up. So you're going to use something like Aquaphor or A&D ointment or some sort of petroleum-based ointment that you know is safe and that's not too old. How long is this going to take to heal? Generally, most of these treatments take about a week and a half to heal, give or take a couple days. At the most, 3 weeks for really, really difficult tattoos on darker skin, and sometimes at the least, people can heal in 4 or 5 days. That's not to say that these are going to be painful the whole entire time, but they're not going to look good for a couple weeks, and they're going to fade over a period of months. So after the treatment, you're not going to see anything, usually any fading at all, unless it's just shading. You're not going to see any fading for about a week, and then you're going to see more fading for the first month, and then the fading is going to slow down over the next couple months. And generally, at about 3-4 months, it's pretty much going to be done, although these can fade even longer than that. Then you'll come in for your next treatment, and you do the whole process over again.